Okay. Hello, everyone. Welcome to the CFES Live Chat. We're excited today to have Dr. John Fortune with us, who is an active trauma surgeon and faculty member from the University of Vermont Healthcare System, who is here to answer all of your questions and inform you about careers in healthcare. We're broadcasting live from Saranac High School in honor of Adirondack STEM Week, which we are celebrating throughout the schools, the Adirondack schools of CFES. Welcome to all of you. Welcome to the schools joining us online. Dr. Fortune, the floor is yours.
Great, thank you very much. My name is John Fortune. I'm a trauma surgeon over at the University of Vermont Medical Center. I've been in this profession for about 34 years, and my goal today is to discuss healthcare careers with all of you and maybe convince a few of you to think about healthcare careers a little more closely as you kind of proceed on in your educational venture. First of all, how many of you in here, and there's about 20 people in here for those that are online, already have kind of thought that healthcare might be a good career for you? So, wow, that's about 10 or 12, 13 people in here, which is great. What I'd like to do for the first few minutes is tell you a little bit about healthcare careers and some of the attractions of that particular area for your possible choosing. And then I'm going to open it up for questions. Hopefully that will be directed towards some of the things that I do and answering some of the questions you might have broadly about entering into the healthcare professions. Excuse me. So first of all, I guess I want to talk a little bit about the attraction of a healthcare career, realizing that this just isn't being a doctor. Healthcare careers really include all work done in the support of health for individuals in this country. So that includes nurses, physical therapists, occupational therapists, radiologic technologists, pharmacists, PAs, nurse practitioners, EMTs, paramedics, anybody that's involved in the health of individuals in this country, we call healthcare providers. One of the first things to consider in this profession is job stability. There's data out there now about the need for healthcare professionals in the future. When we look back upon healthcare and its contribution to the workforce, back in 1950 or so, only 2% of the workforce really were in healthcare. Now it looks like about 12% of the workforce is in healthcare. So a huge jump, a huge need. Right now, there's 17 million people in healthcare careers. By the year 2022, there's going to be a requirement for nearly 22.5 million people working in this profession. A huge jump. Most of those in the nursing professions, whether that's in the hospital, clinics, or in nursing homes or at home, but all areas of healthcare are going to require a lot of individuals to enter into the profession. So why is it? Tell me the answer to that question. Why are we going to need more healthcare professionals in the future?
People are getting older.
Yeah, people are getting older. So it's been estimated that by the year 2025, 25% of all people in America are going to be over the age of 65. Older people, unfortunately, tend to have more health problems. Our lifespan is enlarging, which opens up the door to the care of more chronic disease. So it's been estimated that about 25% of the additional healthcare requirements in the future is just going to be due to the aging population. So, number one, choosing a healthcare career, you'll always have a job. What about compensation? It turns out that for the amount of education required for a certain position, those people in healthcare earn about 10 or 20% more than others with the same level of education. So, for instance, nurses in the hospital have salaries of about $50,000 to $70,000. Pharmacists, $90,000 to $100,000. Nurse practitioners, PAs, have salaries that are way, way over the national standard. You'll always have a job. You'll always get paid well. What about gratification? Well, it turns out that when they've done studies of appealing jobs in the United States, and this is done by U.S. News and World Report, the top 7 or 8 jobs that have been reported are in healthcare. Number 1, dentistry. Number 2, nurse practitioners and PAs. All have responded in surveys that they've enjoyed their position. You'll always have a job, you'll always get paid well, and there's enjoyment in what you're going to do. And finally, and this is very difficult to illustrate without a case, there's incredible gratification day in and day out, knowing that you're just helping people in healthcare. So let me tell you a story. There was a patient I took care of, his name was Mike. He was in a very, very serious car crash in Watertown, New York, which is north of Syracuse, where I was at that time, and he was dead at the scene. At the scene, the EMTs and the paramedics were having to do cardiopulmonary resuscitation. They were starting IVs, they were getting fluids into him. They sent him to the regional hospital, who helicoptered him down to us. We gave him blood transfusions and performed emergency surgery on Mike. Mike's hospital course was very prolonged. He was in the intensive care unit for 4 weeks. He had 3 or 4 operations performed on him. He required medications to maintain his blood pressure for 3 weeks. He was on the ventilator for 3.5 weeks, and in the hospital a total of 6 weeks. Went on to the rehab center, was there for about 3 months, getting his gait back, getting back into the activities of normal living, and then went home after 2 more operations. And he came back to see us in the clinic about 6 months after his very, very serious crash. And he brought someone with him that really made this all worthwhile. He brought his daughter, Kayla. Kayla was 4 years old at the time. And we all commented that it was wonderful and gratifying to get Mike back up on his feet, get him back home, get him back to his job in a period of time. But the most gratification that all of us got from taking care of this case was knowing that we got Mike back to his daughter, Kayla, and Kayla got her father back again. There's no other profession that you can impact people's lives on a day-to-day basis because they need your help. And that's really one of the major reasons that I went into the profession that I did. So what does it take? And how easy is it? When you really look at this, you will find that there'll be challenges. You will need an associate's degree at least, and more commonly a bachelor's degree and sometimes a master's degree to enter into this profession. If you want to be a physician, it's 4 years of medical school and 3 to 5 years of residency. It's going to be tough. But all of you in this room can do it. Because with commitment and with a hard drive and with grit, as they say in CFES, the challenges can be overcome and you can enter into this very gratifying profession of the healthcare specialties that we have. I've enjoyed doing what I've done for the last 34 years and certainly would recommend it to everyone in here and everyone listening on the web. It's been a lot of fun. So, do you have questions? Yes?
What defines trauma?
So, trauma. I'm a trauma surgeon. Trauma is defined as personal injury. So, anything that causes an injury to an individual from an external force. So, a car crash with an impact, stabbing, gunshot wound, a fall that causes injury is defined as trauma. So trauma surgeons basically are surgeons that take care of the trauma cases that require admission to the hospital. So only of all the trauma cases, 5% will eventually require admission to the hospital. Those are the ones that we provide the care for. The other 95% are usually taken care of in the emergency department by emergency department physicians who are highly qualified to take care of those lesser injuries. So a typical trauma patient would be one who was in a car crash, who has sustained chest injury, broken ribs, an abdominal injury, maybe a ruptured spleen, or an elderly person who falls and cracks their head. They have bleeding into their brain associated with a broken arm or a broken leg. All of those injuries in combination make them candidates for a trauma surgeon and a trauma center to provide their care. Another question?
What did you major in as an undergrad?
So that's a very interesting question because I majored in English literature. And I get asked a lot about what major I would recommend for somebody who wanted to go to medical school or wanted to go into the professions that require a graduate degree. And I can tell you, it kind of shifts year to year as to what medical school admissions committees are looking for. Some years they're looking for someone with a broad liberal arts background, and some years they're looking for those with a scientific background. Personally, I believe that if you go into medicine, you're going to be dealing with biology and chemistry and organic chemistry for the rest of your life. Your education is going to be focused on that, and your profession is going to be focused on that. So I would recommend in undergraduate school, to broaden your horizons, take something that's not related to science. Now, you have to take certain prerequisites to get into medical school. You have to take a math course, a physics course, basic chemistry course, organic chemistry, physics, and biology, but the rest of the courses are your choice. In fact, we had a question asked earlier today whether Spanish would be a good major to take. And indeed, that's perfect because number one, Spanish makes you a little more attractive to the medical school admissions committees because it's something different, something special beyond just a straight scientific background. And also, a undergraduate degree such as that opens up the doors to when you get into practice to communicate better. In English literature, I think I got a good background in writing, so my writing skills are better. So I really do think that I made the right decision. That doesn't mean that if you have a scientific major in college that you're going to be looked at any differently or less by medical school admissions committees, but I think you ought to use that opportunity to kind of broaden your experience and broaden your educational opportunities. Yeah.
How do you manage stress?
Whoa, the best question of the day. It's very difficult to manage stress. I think what we try to do in medicine is separate our work activities from our out-of-work family activities. You leave your job at the door when you leave the hospital. Sounds great? Impossible. I'll tell you that when you operate on somebody, like in my profession, and things don't go well and the patient remains in the hospital sick, maybe not as a result of your operation, but because of other diseases they might have, and is not doing as well as you would like, you take it home. It keeps you up at night. It wakes you up early in the morning thinking about what you might have done differently. So managing stress is incredibly difficult. I think the best thing you can do within your capability of doing it is try to separate that medical career with your home life. And again, it's very, very hard to do. I have to make an admission that I haven't made very often. I gave up my clinical practice about 6 months ago. One of the reasons I did that is that I just couldn't manage the stress anymore at my age. Not that it was any worse. It was just that, you know, life was getting short for me and I wanted to enjoy other aspects of it. So it's a good question. There really is no answer to that except for the individual to try to do their best to separate out those factors that result in stress in their life from those that really result in enjoyment of their life. Good question. Yeah.
Do you have children? And if so, is your time with them limited due to your career?
So that's another very good question. I think it's a question that a lot of individuals who are considering going into healthcare professions ask because it's a commitment. Not only is it a commitment to go through the educational requirements, but also when you get out to deal with some of these issues that I talked about, separating your work and your family life. So medicine more and more at the physician and in fact at all provider levels is really becoming much more partitioned. By that I mean that we all work together as teams and that when you're working and available in the hospital, you're running at full steam ahead, you're taking care of what needs to be taken care of, you're concentrating on all those aspects of helping people. And then when you are able to go home, you leave that responsibility with the next person who's on call. So this team-oriented approach is becoming more and more pervasive in all the healthcare professions, so that when you're not in the hospital, you do have some time away. My kids are now 25 and 27 and very successful. I must say that I do regret not being available quite as often as I could have been for them. I missed some birthdays, I missed some pretty important celebrations because I was on call, or I was doing surgery, or I was taking care of somebody who had just been injured. On the other hand, my wife was very flexible in picking up the slack, and I think my kids were very understanding. And it was part of the profession that I felt with the appropriate compensations I had at home that I could live with. So, answer your question, probably didn't spend as much time with my kids as I probably could have or should have had I not been in this career, but I don't regret doing what I was doing. Unfortunately, my kids have turned out to be okay. One of them's in law school and one of them's in wildlife biology. Yeah.
What did you enjoy most about your job?
Dealing with people. There's no question that dealing with patients as people and not as diseases or not as particular problems or not as clinical scenarios is really the aspect of my job that I enjoy most. I've moved around a lot. I've lived in Albany, New York, and Tucson, Arizona, Springfield, Illinois, Syracuse, New York. And always I have gotten to know people in those areas from their personal perspectives and have gotten really involved in what's gone on in those communities and what's important to the people in those communities, which really has been an important part of my job. The other thing is that I'm an educator. I'm a surgical educator, which means I deal with students and I deal with residents. And I must admit, the education aspects of the position have been incredibly gratifying. There's nothing I love more than helping out a resident on a very difficult case and having everything go well and seeing the smile in the resident's eyes, and on their face when we finish the case, knowing that we've been successful and that resident is really sorry. Good question. Yes.
What advice would you give to your younger self, knowing what you know now?
Another good question. What advice would I give to the young John Fortune that I didn't know then? Well, I think there's a lot of things that I missed out on because I probably tried to make my life too complicated at the time. So I tried to take on more responsibilities than, not that I should have, but that my life should have allowed, right? So when I was younger, I wanted to do clinical medicine, and I wanted to do research, and I wanted to do an administrative job, and I wanted to be an entrepreneur, and that was way too much. I'd say I should have focused a little bit more on just one aspect of my life, which would have left much more time for other aspects of my life. I don't know, good question. Ask yourself that question in 50 years and see what it means.
Do you recommend playing sports during medical school?
I do. I think playing sports during your entire life is important. In college, I was on the soccer team. I was on the varsity soccer team. And intramural sports were a major part of our extracurricular activities in medical school. But your health is really the most important asset that you have. And by playing sports or maintaining your exercise schedule is really one of the best things you can do to maintain your health. So playing sports, what a great way of maintaining your total personal activities in your medical school or in your education. Recommend it for everyone. Yes.
We have one
Andrew's got a
from
question.
someone online.
Okay.
What kind of college should I go to for undergrad if I want to be a doctor?
I don't think it makes any difference, quite frankly. I think the outcome of your undergraduate education is not necessarily determined by your college, okay? It's determined by you. and how much effort you put into your education and how focused you are on your education and how much commitment you have towards your ultimate goal. So, you know, I went to Duke University, and at that time it was the top 5 universities in the country. And I can tell you, yeah, maybe that helped my admission chances a little bit when I went to medical school. But I can tell you the grades I got, the work that I did, the extracurricular activities I was involved in, the courses that I took, all contributed just as much as to the college that I went to. So I would say that there's a lot of factors that go into picking your college. Some of them having to do with prestige. There's a little bit of a prestige factor in getting into medical school, but not all that much. Some of it has to do with where the college is for your home situation, has to do with finances, has to do with the particular strengths of the college with respect to what your undergraduate interests are. And all that should contribute to your choice just as much as to whether you think it's going to help in medical school. I just don't think it really makes all that much difference. It's all up to you and not the college. Hey, this has been fun. This question is really difficult you're asking me. Yeah.
What was the most bizarre surgery you had to perform?
So the most bizarre surgery, and actually when I give this talk, is one that I can show some slides on if anybody wants to come back and look at it. But there was a case once that involved a young man who was out hunting on a hunting trip. And he fell from the 2nd floor of his hunting lodge. There was no stair, there was no barrier there on the edge of the 2nd floor because they were just building. And so he fell, and he fell onto an aluminum chair. And this aluminum chair had prongs that came up that held the canvas between them. And he fell right on one of those, right on his back. So this aluminum prong went into his back right there. And he came into the emergency department lying on his stomach with this thing sticking out about a foot. They'd cut it off the seam, and it was beating. It was going thump, 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 thump with his heartbeat. And it was the most bizarre thing I've ever seen. And I'm thinking, wait a minute, this thing went in his lower back, and it's beating like his heart. How can that be? Well, we got an x-ray of him, and darn if it didn't go in up along his abdomen, through his kidney, through his diaphragm, and the end of it was sitting right next to his heart. And I can tell you that was about as nerve-wracking as anything I've ever seen of how we're going to get this aluminum pull out of him that entered down near his butt and ended up around his heart. So we called our cardiac surgeon, and we called the anesthesiologist, and we got him off to the operating room, and we made an incision in his abdomen to locate it in its abdominal location, an incision in his chest to see where it was in his heart, and very, very carefully we pulled it out. Fortunately, this thing went in and didn't injure any major organs. We thought, oh my God, we're going to have a heart injury, or we're going to have an intestinal injury, or we're going to have a lung injury, and it kind of snuck its way in between all of the organs. And he did great. He came back, was in the hospital for about 5 days, came back 2 weeks later. It was fantastic. But I can tell you that was exciting.
Do you have a favorite type of surgery?
You know, I'm a general surgeon, so I'm the type of person that I'm an adrenaline junkie, so I like the exciting surgery. So the types of surgery I like are those that are unknown, that we don't know what we're going to find. Now, I say this because it's exciting for us, but you always have to put it in perspective that it's tragic for the patient. But if somebody were to get, let's say, shot, and the bullet goes in here and comes out here, and we don't know what's been hit in between, then for me, that's kind of exciting, because I don't know what we're going to find, don't know what I'm going to have to do, how much involvement we're going to have with the surgical instruments that are available. And it's challenging, but usually we fix things up and patients do well. So that's the challenging one. surgeries that we just don't know we're going to find, that we're doing kind of because we either have to, that of penetrating injury, or because the patient's doing so poorly that we have to find out what's going on. So surgery on the unknown is what I do.
What is your average workday like, if any day is average?
So when I was in clinical practice, we had a team of surgeons that worked together. Now, I didn't do a lot of elective surgery. We did some. Elective surgery is those surgeries in which the patient comes to see me in the clinic and they have a problem that requires surgery, and then we schedule the surgery for a specific day at a certain time. I really didn't have much of a practice like that. All of mine were emergencies. So a lot of what I did was provide coverage and take care of the patients that came into the hospital that required our services. So our coverage really were in 12-hour shifts. So one day I might be making rounds from 7 in the morning till 7 at night, and then I'd have the night off. One day I might be in the operating room taking care of patients that needed surgery over that same time frame. And then every 5th night, I would stay all night long on a 24-hour shift and take care of everything that came in through the night. So we would work about 10 or 12 hours a day, make rounds throughout the day, perform surgeries if they required, take care of new patients that came in the emergency department with trauma or emergency general surgery problems. But when we went home, we pretty much went home underneath that particular arrangement that we had. I took calls 6 nights a month. To stay up all night long, some nights it was a 24-hour shifts. It was rather challenging some days, but again, very gratifying at the end of the day, knowing you've helped the number of people that you've helped. Now, we've been focusing on physicians and surgery for healthcare professions. I just want to really make sure everybody understands that there's a wide variety of professions out there that are very attractive for somebody at your age looking for a very, very satisfying career. And I would suggest that you keep your mind open to looking at all healthcare careers and kind of pick one that really seems to appeal to you. Another question I get asked is, well, what defines, or what should I be looking for to help me choose a healthcare career? And I will say, and this is not a very good answer because it's not very objective, but it's basically, listen to your heart, listen to your gut. Whatever makes you feel good, whatever excites you, whatever you feel like you might be willing to devote your life to is what you ought to choose. Can you articulate that in terms of clear language? You can't, because it's all the feeling you're going to have when you come across the thing that just meets the requirements for you for that type of career.
Are there any last questions?
Oh my gosh.
Last one.
Another challenging question.
No, this one's pretty easy.
Oh, okay, good.
Is there what would be the average salary for somebody who decided to go into general surgery?
So it varies. It varies by location. It varies by your specialty area. Most general surgeons, when they come out of the residency, are starting salaries about $240,000 a year. And the average salary is somewhere between $300,000 and $325,000 a year. But I will tell you, we work pretty hard too. So that's more than a 40-hour work week. So, probably the work week is more like a 55-hour work week in order to earn that salary.
Great. Well, Dr. Fortune, thank you very
You bet.
much for joining us today.
Sure.
Thank you, Saranac High School, for hosting. Our next live chat is March 29th, where we'll have 2 representatives from Clinton Community College, again, furthering our STEM conversation and talking about a lot of exciting programs there. Thank you very much for joining us.
Thank you.